Okay, some years ago, I was invited to go out to Shipshewana, the state of Indiana, and that's where Dr. Streeter was practicing. Are you still there? You know, in Northern Nutrition, it's this huge health food store and practitioner complex run by the Amish. And so I did a presentation for the practitioners, and I talked about the three conditions that I think are largely ignored by conventional medical doctors. One is candidiasis. We heard a lot about that this morning. And then another one's parasites. We heard some stuff about that because there's an awful lot of people that do have parasites. When I was in school, I was told that was a third world country problem, but of course most of the food we're getting is coming from third world countries now. And then the third thing was about thyroid problems, because I don't treat tests, I treat people. And I had learned many years ago from Dr. Broda Barnes, probably about 40 years ago, that people can have a normal thyroid blood panel and still have thyroid problems. So I believe that's what Dr. Streeter is going to be talking about. Dr. Streeter's bio is on the front page. Did everyone get this? Everyone get this thing? If you don't, let us know and we'll get you some more. Everyone got this? It says professional training event and has Dr. Cal Streeter's name at the bottom. So I'm not going to take up any more of Dr. Streeter's time. He can tell you about his background if he chooses to do so. Let's give a warm welcome for Dr. Cal Streeter.
Thank you very much. Thanks, Dr. Weiner. Our paths crossed years ago, and I'm sorry we haven't been together for a while. And I told him, you better come over to Shipshewana and teach us about nutritional frontiers. I've used his Iodine Plus for quite a little while. So I know about Iodine Plus, but a lot of the other things, you've got a lot of other good products, and I want to learn about them and I want to use them. And I appreciate Dr. Weiner invited me to be here in Nutritional Frontiers. I'm an osteopathic physician, and now let me just say this. How many chiropractors are here today? Okay, now let me just say this to you. Do not be as stupid as the osteopaths were. The osteopaths 75 years ago are right where the chiropractors are today. Okay? And they persuaded us to take an unlimited license. Okay? On the other end of that unlimited license is a hook. Okay? We want to be just like the MDs. Now we are. We traded our clinician status for scientist status. Okay? A clinician gets people well. A scientist, he just runs tests, okay? And 99% of the osteopaths today are just like the MDs, okay? You wouldn't notice a difference. I'm a throwback to the old-time osteopath, all right? People come to me because they want to get well, not because they want me to look at their lab work. I don't care how the lab feels. I want to know how my patient feels, all right? I don't think I'm any smarter than anybody else. I've just been around longer. All right, I'm 77 years old, and I've got 5 grandkids want to be what I am, and I aim to stay around till I get them trained. I sat back there today, and my grandson, who's a sophomore in osteopathic school, texted me 4 or 5 different times. He always tells me, Grandpa, I'm never going to get anybody well learning what I'm learning. He said, all these guys are hospital doctors. They don't know anything about getting people well. Now here's the whole issue in a nutshell. All of our doctors are trained to take care of sick people. They're way down here, way down at the bottom. Health is up here, sickness is way down at the bottom. Unless you're way down at the bottom, they shouldn't be treating you. And if you go to the average doctor, most of us will be in between someplace. We're not way down sick and dying. But if you're only trained in sick and dying medicine, that's all you'll use. Now, if we treat sick and dying people with nutrition and health and wellness, we're going to get in a heap of trouble. But they bury their mistakes. Okay? All a surgeon has to do, or all a MD or DO has to do is say, I did the best I could. And he gets by with it. All right? And that makes me angry. Now, why am I in the health and wellness business? I believe God made a body that will take care of itself better than I can. I never play doctor. I let the body play doctor. You give the body what it needs, it's the best physician you'll ever find. Now let me stop right here, and I do this before I give any lecture. I promised God I'd do this years ago. The biggest cause for health failures in our country and in the world is stress. And the biggest stress you'll ever have is not knowing where you're going to spend eternity. Now, I'm not talking about a religion. Listen, hell's going to be full of religionists, okay? I don't care who your priest or preacher is. I don't care what church you go to. When you stand before God, they're not going to say, what church did you go to? How good were you? They're going to look at the record. If I've got one sin marked on my record, I'm going to hell. I don't have any racer big enough to race those sins in heaven and that record in heaven. Only one person ever came, died, rose from the dead, and took a perfect record back to heaven. And the second you trust Him as Savior, God takes that sinful record that belongs to us and puts under His name, and that perfect record He took back to heaven, He puts under our name. From that day on, there's never a sin marked on our record. Now, I don't care what baptismal pool you've been baptized in. I don't care what sacrament you've taken. I don't care how good you are. Unless you've got a perfect record, you're going to hell. Well, you say, I got my religion, I got my preacher, and you're going to sit right beside him in the same place. Okay? I'm not going to heaven because I'm better than you or because I'm a good fellow. I'm going to heaven because April the 17th, 1954, 61 years ago, I by faith accepted Jesus Christ as my Savior. From that day until this, I've never wondered where I was going to spend eternity. Now, you've got a right to be stressed out if you don't have that. My boy's sitting in the back here. You raise your hand, son. There's a whole stack of tracts out there. Not church tracts, gospel tracts. Someday you'll stand before God. You take one of those. It's not between you and me, it's between you and God. I wouldn't change the religion. I talked to a Muslim fellow the other day, and he said, I'm Muslim. And I said, I wouldn't change the religion, but I'd like to change the direction. I said, where are you going to spend eternity? He said, I'm Muslim. I said, does that get you to heaven? He said, what are you talking about? I gave him a gospel tract, and I said, listen, I want you to go to heaven just like I want everybody else to go to heaven, and we don't go to heaven because of our religion. Now, that's off the subject, but I want you to know where I'm coming from and why I'm where I am and why I'm the kind of doctor I am. If you don't like that, I'm sorry, you're stuck with me, okay? Now, thyroid problems. We'll talk about three different areas probably: the thyroid, the pituitary, and the adrenals. Those three areas are pretty important. The thyroid gland is right here right around our Adam's apple, okay? It controls our metabolism. Now, we've got an epidemic of thyroid problems. Ladies have lots more thyroid problems than men do, and we'll talk about that in a little bit, but here's our issue. The average doctor is trained to look at TSH, thyroid stimulating hormone that comes from the pituitary that stimulates our thyroid. That's like a farmer looking at a hole in his fence from 25 miles away. You might see it, but it's not likely. It's so far from the thyroid, it's not going to do the trick. And they've got the parameters so wide, you'd have to be dead in order to have that be off and know that you had a thyroid issue. All right? Now, I'm just telling you where I'm coming from. I take a history on all of my patients. And the history tells me what that patient's got going on in their body. And you better learn to take a history. When we traded our clinician status for science status, we quit doing histories. All right? And that's where you find out what people have going on in their body is by a history. Okay? The patient's body will tell you what's wrong. Now, the other problem you have, we put 1.5 milligrams of iodine in our potions and say we fixed it. Well, 1.5 milligrams of iodine will keep you from getting a goiter, and it will keep you from having cretinism in your kids, but it'll never give you a healthy thyroid. All right? Look, our thyroid produces thyroxine, basically. That's 4 atoms of iodine per molecule of thyroxine. Iodine and selenium combined to form thyroid peroxidase that converts T4 to T3. That's the active thyroid. That's 3 atoms of iodine per molecule of liothyronine. Here's what happens. Every time a lady ovulates, she uses thyroid. There's no iodine in our soils to replace it, and we're all deficient in the iodine, and we don't eat enough salt. If we did, we probably wouldn't get enough iodine in the salt to do us that much good. Our bread used to have iodine in it, but now we make it with bromine, and bromine is a competitor for iodine, okay? And so she runs out of iodine. Breast tissue requires 3 times as much iodine as the thyroid does. Thank goodness men don't ovulate. And we don't have breast tissue to fight with. So the only way a man gets hypothyroid is if mama was hypothyroid. Okay? I'm seeing more and more men with hypothyroidism because we got more and more moms having babies that are hypothyroid, okay? Now that's the only way a man gets hypothyroid. Now, here's the whole issue. If you're producing thyroxine without enough iodine, it does not shut down the thyroid stimulating hormone from the pituitary, so it keeps screaming at your thyroid to give us more thyroxine. The thyroid says, I'm doing all I can do. And the only way it can give you more is to hypertrophy. That's a goiter. We're in the goiter belt. This is the Great Lakes region, okay? Now, if you don't take care of that, when it's at that stage of the game, the immune system kicks in to try and help us, and it ends up attacking us. That is autoimmune disease. Thyroiditis, Hashimoto's thyroiditis, and if you see anybody with an autoimmune disease or an autoimmune problem, it started with a low thyroid. I had a lady in recently with MS, and I said, how long have you had hypothyroidism? She said, I don't. She said, I got a couple nodules on my thyroid. Well, I said, what do you think that is? Okay, if you don't take care of it when it's hypothyroidism, then it goes to thyroiditis, then it'll go on to Graves' disease, then it'll go on to thyroid nodules and tumors. I mean, it'll just progress right down the line. I want to get it before it gets to that stage. And if you don't take care of it when it's early in Hashimoto's thyroiditis, it's going to destroy the thyroid. Now, I hear this, and I hear it over and over and over again. Don't ever give anybody with thyroiditis or anybody with Graves' disease iodine. Are you stupid? You got to get thyroid iodine to them. Now, here's the problem. The body, if you got autoimmune disease, the body is going to rebel at iodine, and it's going to treat iodine like it's a poison. You have to persuade that thyroid or that body to shut down the autoimmune attack. I have tried everything, okay? I've tried low-dose naltrexone, I've tried hydrocortisone, I've tried Moducare, you name it, I've tried it. Some of it works, some of it doesn't. Most generally it takes so long to do it that people get tired of waiting. I got shingles a year ago. I got a little brother that's a surgeon. He's a cut up in our family, okay? He's 4 years younger than I am, and we have our differences sometimes, okay? But he checked my prostate. I came away from his office and I had blisters around my perineal nerve all the way around. I tried everything. I tried what he gave me. I tried what my son, who's an integrative physician and an emergency room physician, told me to do. I tried everything I knew to do, and I still had big blisters. I got an oxidative stress inhibitor. The boy will give you a brochure on that. In a week, my shingles were gone and my scars were gone. That got my attention. Okay, I said, if that will shut that down, maybe it will shut down autoimmune attack on our thyroids. I've been using that now for the last year. Now, I'll just tell you this. If I get somebody, I had a patient in recently that had a TPO, a thyroid peroxidase antibody that was 2,060 or something, and her doctor said that wasn't a problem. 9 is normal. That's the problem we got. Doctors don't know what to do if they find it. If it comes to it, they're not trained to take care of it, and unless you're dying and you're really in trouble, they don't know what to do. But when I get somebody that's got a thyroid peroxidase antibody that's that high, that means there's something competing with that TPO, okay? And you're not going to be able to take iodine. You're going to have to shut that autoimmune attack down. I put her on naltrexone. I put her on a little low dose of hydrocortisone. And by the way, hydrocortisone, 10 to 15, 20 milligrams of hydrocortisone 4 times a day is not going to hurt anybody. William McKinley Jeffries wrote a book on that, back in the 1960s, the safe use of corticosteroids. When cortisone came out, it was a wonder drug. Wonderful, wonderful, still a wonder drug. Then the pharmaceutical companies started making synthetic cortisone, prednisone, dexamethasone, solumedrol, 100 times stronger than hydrocortisone. Little wonder you have problems. You trade moments of relief for years of agony. It's a good product if you're dying. You don't care about the side effects if you're dying, but for the long-term effect, you don't want to leave people on that for very long. But 5 to 10 milligrams of hydrocortisone, boy, it's wonderful. It'll shut down the autoimmune attack pretty quick. But you don't want to leave them on that for a long time either. But I've used the oxidative stress inhibitor. I'll tell you what it does. It's an NRF2 pathway activator that gets glutathione right into the cell. That's where I want to get it. All of the other stuff we use works extracellularly. That works intracellularly. Once you can get something intercellular, that's 1,000 times more potent than the stuff that's working extracellularly. Now, you can look at the card. You can take the card and look at it, but it's a good product, and I use it. Now, I also use, once you get that immune system settled down so that your body can accept it, it'll accept iodine very, very well. You can use Iodine Plus, and it'll take that very well. Now, the one thing I like about Iodine Plus, it's got some selenium in it. It's got tyrosine in it. It's got what you need for your body to use the iodine. Okay, I mentioned this a while ago, and I'll say it again. I'm not a cancer doctor, but I'm I get inundated with cancer patients. You don't ever give a lady thyroid without iodine, ever. It increases her risk of breast cancer by 3 times. Okay, you know how many ladies I see on thyroid that aren't on iodine? Scary. Scary. I never put, yes sir.
So you're referring to Synthroid or something else? T4?
Any kind of thyroid. Synthroid, ecothyroid, nature-thyroid, armor thyroid, all of them. It increases metabolism. You don't want to do that without iodine in the system. I'll just say this right here. If I get somebody, the book says if you've got I'll get into that after a bit, but it says that iodine and selenium in high doses causes apoptosis of cancer, of glandular cancers. If I get somebody that's got a glandular cancer, whether it's breast cancer, prostate cancer, you name it, I'll give 8 Iodine Plus capsules twice a day and 4 200 microgram selenium capsules a day for 2 weeks. 50% of those cancers are dead after 2 weeks. I'm going to do that before I ever see anybody get a chemo and radiation. You're not going to hurt anybody for 2 weeks of that. The other thing I use a lot of, and I'll tell the pharmacist that was talking to me a while ago to sit still here for a minute, I use high doses of vitamin D3. The book says if you got an inflammatory process, a degenerative condition, an infection that won't heal, you use 1,000 units per pound of body weight per day for 10 days of vitamin D3, and you'll get 95% of those people well. I'll give you a case in point. We'll talk about weight loss here in a little bit, but I had a lady come to me, wanted to be on my weight loss program, and they had to help her in my office because she had MS so bad. I told her when she came in the office, I said, I can't put you on a weight loss program. I said, you got to get this MS under control. She said, help, I've been all over the world. I put her on 4 50,000 unit vitamin D3 capsules a day. She weighed 208 pounds. I gave her vitamin K2. I use a K2 booster. You got to give high doses of vitamin K2 if you're going to use that much vitamin D3 or you'll get kidney stones. Okay, you just do that. I gave her that for 10 days, and I said, don't you tell a living soul how much vitamin D3 you're on. She walked into my office in 6 weeks in high-heeled shoes. She said, I don't have MS, I've got a vitamin D deficiency. That got my attention. She's lost 67 pounds in my weight loss program, and she still doesn't have a symptom of MS. Now, I'm going to try that on anybody that's got a degenerative condition, an infection that won't heal, or an inflammatory process. If I get an infection of any kind, I'll take 3 50,000 unit capsules a day for 2 or 3 days and my infection's gone. It doesn't like my D3 at all. Okay? Again, I like the body to get us well. If you help the body and you do for the body what it can do for itself, it'll get dependent on you. It'll say, if you're going to do it, why should I do it? That's exactly what happens when you give high doses of cortisone. Is you start giving prednisone and you give it for a long period of time, the adrenals say, why should I do it if you're going to do it? And you have a lot of patients with Cushing's syndrome. It's just like Addison's disease, it's just different cause, shuts the adrenal glands down. Now, I said we're going to talk about the adrenals. You're going to have adrenal exhaustion if you have thyroid conditions for very long. Because the adrenal glands help you run faster when the dog's chasing you, but it also helps you to cope with diseases and cope with organs that fail. Okay? And it won't be long if you got thyroid failure that your adrenals are going to be exhausted. They've got a very good adrenal product here. You better look into it. Okay? I give those things. Now, the beauty of using hydrocortisone instead of using prednisone and dexamethasone is that you don't shut the adrenals down when you use thyroid extract or adrenal extract, okay, in low doses. Just like you don't shut the thyroid down when you use thyroid extract, okay? Now, if you're going to do thyroid checks, and I'll just tell you this, I usually treat my patients for a month before I do any blood work. I'll do a history. How do I know if I got thyroid problems? Go down and do a history. Gastrointestinal tract. First sign you have of thyroid problems is constipation. Okay? Somebody comes to me and they're constipated. I said, I wonder how long they've had a thyroid problem. If you got any other gastrointestinal problems, irritable bowel syndrome, indigestion problems, symptoms of thyroid problems, genital urinary tract. If a lady has menstrual irregularities, ovarian cysts, infertility problems, she's got a thyroid deficiency. I got a text from my oldest daughter, Father's Day, a year or so ago. She said, Happy Father's Day, Dad. I'm glad you're my dad. She said, first I couldn't get pregnant. You gave me thyroid. And she said, in 3 months I was expecting. She said, then I had a miscarriage and you gave me bioidentical hormones, bioidentical progesterone. She said, I got 3 healthy children because you're my dad. Thank you very much. I like that. I like that a lot. She was just thinking, okay? But now, it's one thing to take care of the public, it's another thing to take care of your family. Okay, and she was just complimenting me, and I'm glad she did. But now let me just say this: if you got somebody that's got a urinary problem, an ovulation problem, they got a thyroid deficiency. That's where you better start. Okay? Cardiovascular problems, high blood pressure, heart irregularities, slow heart. You think of thyroid. Neurological, headaches, pain. Okay? Those are symptoms. Thyroid. Cardiovascular, high blood pressure, slow heart. Those are symptoms. Okay, and you could just go down the line. Go to the skin, hair, nails, brittle nails, hair falling out, especially the corners of the eyebrows. All symptoms. Thyroid deficiency, weight gain, thyroid deficiency. I mean, you go down the line and people, you don't have to do testing to figure this out. All you got to do is run a history and you can say, oh, that patient's got thyroid problems. Go ahead and treat them. Now, I'll start them on a little bit of iodine. I'll start them on iodine plus. I do it a little bit differently. I'll start them on 1 a day. And every 2 weeks, I'll go up by 1. Now, you can do what Dr. Brownstein does if you want to. He puts his patients on 50 milligrams of iodine and does a 24-hour urine on them, collection on them every month. Last time I heard him lecture, I said, Dr. Brownstein, you got any ladies in your practice? He said, what do you mean? I said, you do 24-hour urine creatinine, or 24-hour urine iodine levels every month on your patients, every one of them. I said, I'm glad you do. I'm not going to do that. I said, there's got to be a better way to find out how much iodine patients need to take. Men may be able to collect their urine for 24 hours, but I'm going to have a lady doing that. That's not even smart. Okay, so here's what you do. We go up on iodine until we get a metallic taste in our mouth. Or you go to the pharmacy and you get iodine, medicinal iodine, put a drop on your abdomen. If it's gone within 12 to 24 hours, you need more iodine. That's 2 ways of checking it, okay? Now, I'll use a lot more selenium than they put in their iodine plus. For every 3 capsules of iodine plus, I'll give it 200 micrograms of selenium. I use a lot more selenium, okay? Because I find my patients need more selenium if they're using that much iodine. The soils here are depleted in iodine, and selenium and iodine, just like the soils are back in the Midwest, back where I live, okay? And you're going to have that. I heard Dr. Wallach talk a few years ago, Joel Wallach from Dead Doctors Don't Lie fame. He doesn't like me because I don't promote longevity. If you're not in longevity, you're not in his multi-level company, he won't even talk to you, okay? He and I, interesting sideline, I'll get off in this in a minute, but I was speaking at a Health Freedom Expo. Dr. Wallach was there, Dr. Donsbach was there, and Dr. Wendell Whitman was there. And I got up to speak and I said, now, if I fail to practice what I preach, I forfeit my right to get up here. I said, some of us that are making a lot of money on health and wellness, we need to look in the mirror. Ouch. Dr. Donsbach's had a stroke. I'm not even sure he's still alive. Wendell Whitman is dead. Dr. Wallach had a long talk with himself and got off and he said, I'm going to lose weight. He's lost weight. Boy, he didn't like what I said, but he took what I said and did something with it. Health is not an accident, it's on purpose. You're going to have to take responsibility for it. The medical profession's not going to do it for you. But anyhow, Dr. Wallach said a few years ago, I heard him talking, he said he took 1,000 micrograms of selenium a day. Boy, I raised my hand. I said, Dr. Wallach, how come you take so much selenium? He said, Dr. Streeter. See, I didn't know who I was at the time. He said, in the 1940s, we found animals that got malignant tumors were all selenium deficient. I'm never going to get one of those. Huh. He's a pretty smart old boy. Pretty smart old boy. I never give more than 1,000 micrograms, but I'll tell you what, I'll take 600 micrograms most every day of selenium. Okay? And I'll take 2 or 3 of your iodine plus every day. Okay? I'm just going to do that. Now, here's what happens. If your body does not like the selenium and the iodine, then you better knock down the autoimmune attack. You got to do that before you do anything else. I spend a lot of time on iodine, a lot of time on autoimmune, because that's where the problem lies. The people, the doctors say you don't ever give a patient that's got Hashimoto's thyroiditis or patients with Graves' disease iodine. Of course, because the body rejects those at that stage. If you got those, it's going to rebel at it. Okay? And you have to knock that down. When you knock that down, it'll accept iodine very, very well. All right? Now, the other thing that you want to work on, do you have an iodine cofactor that you use for where the B vitamins, what's the name? They got an iodine cofactor, the A something cofactors that every now and then you get a patient that can't take iodine and can't use it, and they got a cofactor that have B2, B3,
Yeah, Super B.
manganese. What's that?
Super B and Frontier Minerals.
What is it?
Super B at Frontier Minerals.
Okay, Super B and Frontier Minerals has that in it. That's all you'll have to take then. Because every now and then you get a patient who cannot take the iodine, they won't accept the iodine, and they have to have those cofactors. Okay? And you just have to have those, and if you got those, take them. Take them. I'll become familiar with these, Dr. Weiner. You give me a little time and I'll become familiar with all your products. Trust me. Okay? Now,
Do you have the training manual, because it goes over the whole?
no, I'll put one out here one of these days. My grandson's after me. He said, "Grandpa, you got to put all this stuff in print, because I got to know what you're doing," and I'll do that. But I'll sit down and put all this down in print.
But I mean, we have one for nutritional.
Do you have one?
Yeah, we'll get you.
Good. They got a training manual for it. Get it.
It goes through all the products.
Yeah. Good. Now, you say, I've got an enlarged thyroid, a goiter, cyst on my thyroid, thyroiditis. What am I dealing with? You're dealing with an iodine deficiency, selenium deficiency. I had a lady in with an enlarged thyroid. I put her on, because her TPO was a little bit high, I put her on the iodine, or the oxidative stress inhibitor, on a little bit of low-dose naltrexone, and all went away with the iodine. All went away. She thought she was better, so she quit taking it. She was in the other day, and it's all back. I said, "What am I supposed to do?" I said, "I get on the stuff that help you get better in the first place." Okay? Can't take iodine, she said. I'm allergic to it. She had all the symptoms that she came in originally with. All right? You just have to make sure when you get somebody well that they take responsibility and they don't go running off on you. Now, let me just go over to the next page here. I got tons of stuff, and I'm going to skip over a lot of this stuff. What do I do if I suspect I have a thyroid problem and I don't know where to start? What do? Take your temperature. Before you get out of bed in the morning, take your temperature. A couple of days. If your temperature is below 97.8 degrees Fahrenheit, you're thyroid deficient no matter what the blood test says. Okay. If you're still menstruating, wait till after you menstruate. The day after you start menstruating, take your temperature for a couple of days. Okay? That's the best way to check your thyroid. Old Brody Barnes was smart. They made fun of him back then. What he said still works. Okay? And we'll talk about weight loss here in a little bit, but you'll never lose weight unless you get your thyroid, your temperature above 97.8. Never will. All right, you got to do that. Now, how do we do that? I start them on low dose, either ecothyroid or HP thyroid, which is beef thyroid. It's not a prescription. You can get it at the health food store, okay? And you start on one of those ecothyroid 37, and you go up every 2 weeks till your temperature starts coming up. If you aim at 97.8, you'll never overshoot it. Listen, it's a Sherlock Holmes thing trying to find the thyroid that the patient can tolerate. If they don't tolerate one, I'll go to another one. I used to use Armour Thyroid, but Armour Thyroid's got corn in it now. They took it off the market a few years ago, or a year or so ago, and when it came back, it had corn in it. and they're not going to change. I've called the company, I said, who would be so stupid as to put something as unnatural as corn and something as natural as thyroid? I got calls from 3 different people. The last guy I talked to, I said, you wouldn't be getting any money from the corn people, would you? And there's silence on the other end of the phone, so they're not going to change. It's a filler, and they're getting money from the corn people, and it's not going to change. And if half of your people are allergic to corn like my people are, then I'm not going to try it, okay? I use Nature Thyroid. It's a pork thyroid, but it's a good thyroid. I use it. I use Ecothyroid. I use Thyroid HP. If all else fails, I'll call the formulating pharmacist. Have him formulate a beef thyroid that's not a synthetic thyroid and have him make it up for me. And they can do it. They do it for me all the time. You can get a sustained release and it works fine. And every now and then, nothing else works. I don't know what they put in it and what they do, but it works for them. I'm for patients getting better. Okay? If I can't do it, I'm going to find a pharmacist who can help me. And I work with the pharmacist. I tell them, I call them and I'll say, look, I'm going to fax this lady's thyroid profile over to you. I can't seem to get it working for her. Help me out, will you? We work together. I guess they protect me and I protect them. Okay? Now, we do, you want to get is it the B vitamins that you have, and the B vitamins and minerals? You want to get those. I just go ahead and give them because I don't want people reacting. I go ahead and give those to them, okay? And I give them the adrenal stuff. They got an adrenal, what is it, Adrenal 2 that you have? Adrenal Max 2. Give that to everybody who's got a thyroid problem, okay? Most ladies have stress anyhow. They're married to men. Okay. If you'd ask my wife, after 54 years, my wife would agree with that, okay? So they'll need some of that Adrenal Max too, all right? Oh, me. I don't know where that came from now. I still take the oxidative stress inhibitor every night. I like the energy it gives me. Listen, I defy anybody in their 50s to follow me around. Yes?
Is that the DMG, the oxidative?
What's the oxidative?
Oxidative stress inhibitor.
What is that?
Protandum.
Thank you.
Yeah, good stuff. They tried to sell it at Walgreens, they wouldn't sell. Okay? You get a brochure on it, but it's good stuff. I've had to eat some crow. I had a cardiologist try to sell me on it 2 years ago, and I told him to stick in the cardiology field, and I've had to go back and apologize to him. Crow doesn't taste good no matter how you fix it. Okay? Now, listen to this. A healthy diet with adequate amounts of pure water, pure salt, decreased chemicals, no refined sugars and sugar substitutes, no pesticides and herbicides, no trans fatty acids, no hydrogenated oils. You're going to have to become Sherlock Holmes and look at these things. These things mess up our metabolism, and they affect our thyroid. Now, nobody would like to eat like I eat. No, I don't ask anybody to. I get up every morning, I drink a quart of water. I drink 9.5 pH water. It goes through a reverse osmosis unit. It goes through an ionizer. It goes through a filter first, then a reverse osmosis unit, then an ionizer. And I've worked it up till we're at 9.5, and that's what I drink. I drink 2 quarts. I drink a quart in the morning, a quart in the evening, and probably about another quart during the day. In my first pint of water every morning, well, my second pint, I put 25 drops of 35% hydrogen peroxide and 2 ounces of apple cider vinegar. Now, hydrogen peroxide breaks down to oxygen water in your tissue, and oxygen kills pathogens. Those of you that have got candidiasis, it'll kill candida in a flash. They're anaerobes. Okay? And the old timers all used apple cider vinegar. It helps your digestion. One of the problems we got with digestion, we don't eat enough fermented foods.
How many drops of hydrogen peroxide
I started out with 5 drops and I worked up to 25 drops. I did it twice a day for a month, and I didn't froth at the mouth and I didn't get yucky. And so when I got to 25 drops, that's where I stayed, okay? You start at 5 drops and work up. Some people can tolerate it, some people can't. I read an article by Christian Bernard, one of the open heart surgeons, first open heart surgeons. He went out of practice because he had rheumatoid arthritis so bad. He read about hydrogen, food grade hydrogen peroxide. When he got to 15 drops 3 times a day, he went back into practice. That got my attention. I read that kind of stuff and I say, hey, these guys doing all right with that, maybe I ought to try that.
How much of the apple cider vinegar do you use as well?
2 ounces, glug glug. I'm sure it's apple, I'm sure it's all of 2 ounces. Okay. enough so you can taste it. Okay. Now, I have eggnog I make for myself every morning. I have a quart of raw milk, and none of your business where I get the raw milk. And I get 5 raw eggs. I get a scoop of whey protein sweetened with stevia. I put a scoop of cinnamon and some nutmeg, lecithin in there. That's what I have for breakfast every morning. Okay? Now that lasts me all day. Well, I have Bedwig's cottage cheese and flaxseed oil. 3 tablespoons full of that before I start. Listen, when you get 77 years old, you don't ask what tastes good. You take what you're supposed to take. And I put a healthy potion of chia seed on top of that. And that's what I have for breakfast, okay? Now, chia seed's pretty good stuff. You know, the Spanish tried to take over Mexico and they couldn't do it until they killed off all the chia trees because the Aztecs were living on chia seed. Must be pretty good stuff, huh? Okay. Now, I take a quality multiple mineral and vitamin. That's what I would do. They got a good one here. You're going to have to let your body choose what it needs, okay? If your hemoglobin is down a little bit, mine was down a little bit recently, and I take some sublingual B12 and folic acid, and I take herbal iron or a supplement that's got herbal iron in it. My hemoglobin was 12.6 or something, and I went to give blood, and it was 16.4 after a month on that. So I guess it worked pretty well. Okay. Now, if you got a constipation problem, do not take a bunch of laxatives. Take magnesium, much as you can tolerate. Don't take too much. Okay. Now, magnesium increases memory. It relaxes muscles, it lowers blood pressure, relaxes the nervous system. I can't tell you how many kids that had seizures, all I got them on is a little bit of magnesium, and they don't have seizures anymore. Beta-Dilantin and phenobarb and all that other stuff, all to pieces. Okay? Come on. I use the nutritional stuff before I go to the other stuff. Instead of the other way around. Now, vitamin D, you take as much vitamin D as you need. Everybody here ought to check their vitamin D level. I'll tell you why. I was at a conference down in Florida, and the pathologist there had done over 850 autopsies on cancer victims. 100% of them were vitamin D deficient. He said if you're under 80 nanograms per ml, you're vitamin D deficient. 95% of the American public is under 30 nanograms per ml. 99% would be under 80. I keep mine at 100 all the time, and I have a running battle with life extension. I send my lab work into life extension about every other year, and I got a call from them a couple years ago. You got a critical, Dr. Streeter? And I said, what is it? He said, you're toxic in vitamin D. I said, well, what's the level? He said, 106. I said, well, don't you read your own literature? I was talking to a doctor. I said, how many vitamin D toxic patients have you ever seen? He'd never seen one. I said, well, I'll tell you what you do. You take care of the ones that are under 30, and I'll take care of the ones that are over 100. He said, I see we got nothing more to talk about. Okay. Now, here's why they holler about vitamin D toxicity. Every pharmacy has vitamin D2 in it. You can get toxic in vitamin D2 like that. And most of the food additives have vitamin D2 in them. Okay? It comes from vegetables, but it's still a chemical. Vitamin D3 is what we make out of cholesterol in the presence of sunshine. If you could get that, everybody in Florida would be toxic. Anybody ever think of that kind of stuff? That's stupidity. Okay? We're reading too much of the pharmaceutical literature and too much of what the media tells us. Now, here's why we got thyroid disorders. Listen to this. Viral infections, don't ever overlook the possibility of infections. I had a little girl come to me one of the most disastrous times in my life. 7-year-old girl, her mom sat across from me and cried. She'd been everywhere. She'd done everything that I would do and anybody else would do, checking that kid's thyroid. But the thyroid is big as a baseball, hot as a firecracker. And before she came to me, she made the mistake of going to Indiana University. And they checked with all the experts. Experts a little spurt under pressure, okay? And they said, you got 9 weeks. If you don't get that softened up in 9 weeks, we're going to cut that thyroid out. She came to me and I had her go down the hall and have them do a dark field on her. She was crawling with parasites, Lyme's parasites. The parasites had attacked her thyroid. I can get rid of Lyme's parasites and take care of the parasites, but I can't do it in 9 weeks. Okay, and there's a way to kill those parasites off, real easy way. But they cut that little girl's thyroid out just before Christmas. All right, that's one of the sorriest days and saddest days of my life. You'll find out how little freedom we have when you have a minor that has a terminal, quote, terminal illness. I had a granddaughter came into my office, 3.5 years ago. Grabbed me by the arm. She was white as that piece of paper. Short of breath. Grabbed me by the arm. She said, I sure do love you, Grandpa, and wouldn't let my arm go. I sent her over to the local hospital to get an x-ray, and they air vac'd her down to Indiana University and took 5 liters of fluid from around her heart. She had Hodgkin's lymphoma. Her mom's a nurse. She wouldn't listen to me, but she listened to my son, who's an integrative physician and an emergency room doctor. So we put our heads together, and we gave her IV vitamin C before every chemo treatment. We gave her Zeolite 36 hours after every chemo treatment. Her hair didn't fall out. She didn't lose weight. She's been in remission for nearly 2 years now. Okay? She had her mom take her down where they were treating the kids. She said, Mama, why are they so sick? She never was sick at all. And her mom had trouble answering that question. But now, you get a minor, you're going to be in trouble. You're going to be in trouble. Now, let me just say this, ladies. If you're going to have a baby, make sure you got plenty of iodine in you. It makes kids smarter. Kids born to mamas that are iodine deficient have less IQ or lower IQ. If you're going to have a baby, have a smart one. I mean, just want to have some iodine in you, okay? That's cheap. Easy treatment, okay? Now, here's the other reason we have so much thyroid problems. So many problems with too little iodine. Toxic competitors. Bromine, hot tubs, crop sprays, termite and pesticide sprays, some salts, carpets, couches, upholsteries, carbonated drinks, Mountain Dew, Gatorade, some vegetable oils, medications, sedatives, anti-seizure meds, some asthma meds, all have bromine in them. They're a competitor for iodine. That's competing with the iodine that's supposed to be in our thyroid. And by the way, every cell in our body needs iodine. Okay? Now, fluoride in dental fillings, toothpaste, and water for tooth health. How stupid. that fluoride was a byproduct of aluminum refinement, and they couldn't get rid of it. And so they persuade us that we need it for our teeth, and now they're selling it to us so we can put it in our water supply. Brr. Okay, it's a toxic agent causing thyroid problems and cancer. Now, chloride. Chlorine is important in the body's extracellular fluid, but the oxidized form of chloride that's added to many waters and disinfectants and that sort of thing is a competitor for iodine. Municipal water supplies are loaded with it. Outside the United States, it's against the law to use chlorine. We're not that smart here. A byproduct of chlorine use is dioxide. Dioxin? Last time I heard that was a pretty heavy carcinogenic. Okay? Now, perchlorate is found in rocket fuel. Now, why does that affect us? The Colorado River is polluted with perchlorate. Perchlorate competes with iodine that our thyroid needs. Everybody west of the Mississippi River, or west of the Rocky Mountains, drinks that water. If you get vegetables and fruits from the Southwest in the wintertime, and most of us do, it was irrigated with perchlorate. Okay. That ought to help us a lot. Now you wonder why we got thyroid problems? Now, combine that with all the stress that we're under, and I'll guarantee you, we are going to have some serious thyroid problems. I don't know whether I've confused you or not, but everybody deserves individual treatments. I have no two people that are on exactly the same regimen. They all have to figure out what they need, and when they figure out what they need, they kick the doctor and everybody else out of the way. My patients come back and tell me what they need. I'll point them in a direction. Now, we'll talk about hormones next. But the only place we have more problems than with thyroids with hormones. We'll talk about that, okay? No lady wants horse's hormones. Good night. The horse didn't even want those. And we're giving it to our ladies, okay? Now, you want to take a break and then come back, or you want to go right on? Keep going? Let's go right on to hormones, bioidentical hormones. Now listen to me. Ladies produce estriol-dominant hormones and progesterone. Horses produce estrone-dominant hormones and progestins. Pharmaceutical companies make estradiol-dominant hormones, or estradiol, period, and progestins. You don't ever want to be on estrone, you don't ever want to be on estradiol, and you sure don't want progestins. Okay? Anybody know what Premarin is? That's horses' hormones. They got it from pregnant mare's urine. The mare was trying to get rid of that, and we feed it to our ladies and wonder why they got problems. Guess what all of our birth control pills are made out of? Oh. Estrone or estradiol. Isn't that wonderful? Now, here's what happens. Ladies need progesterone. If you've got more estrogen at the end of the month, or estriol and estradiol at the end of the month, and you've got progesterone, you're going to have a problem. Estrogen is what builds up endometrium in the uterus. It's what ladies get rid of every month when they menstruate. If you got more estrogen than progesterone, here's what happens. You can get endometriosis. You'll have terrible menstrual periods. You'll end up being on birth control pills, and before you're done, you'll end up having a hysterectomy. How stupid. Now, men, just in case you think we're out of the picture, we've got an aromatase in our system. Aromatase is not a problem till we get to be about 40 years old. When we get to be 40 years old, we start converting all of our hormones to estradiol. We fatten our beef, our pork, and our chickens with estradiol. Ladies come between, 35 to 40, and they start getting weight right around their midsection. They're behind and they're mad at the world. Men, you show me a man over 50 that's losing his memory, and I'll show you a man that's converting all of his testosterone to estradiol. He'll have fat around his midsection, and he'll have a prostate that's as big as a watermelon. Oh. They got an ester cleanse here, haven't you? Yeah. Except it doesn't have enough DIM in it. You got to take 300 milligrams of DIM a day to block that estradiol. Put a little bit more DIM in there.
Well, we improved the product with Ester Cleanse too.
Pardon me?
We have Ester Cleanse too. We've improved.
Yep, okay. But you need 300 milligrams of DIM. Now, you know what DIM is? It's a cruciferous vegetables desiccated down, put in a capsule. Good stuff. I take DIM, 300 milligrams a day. I take 400 milligrams. I'll take 2 of them twice a day. I take a Chinese product called Myomins. I am not going to let you get better than I am. And I'm not going to have a prostate that's giving me a problem. Okay? If you want to be my guest, I am not letting the urologist get after me. If you don't take care of that, you'll have a urologist standing behind you and wanting to punch holes in your prostate. They still haven't convinced me that there's a good reason to have colon bacteria in my prostate. If somebody can explain how that's a good thing for us, I'll be glad to listen. But my urologist says, well, you're 70 years old, you need to have a biopsy, ultrasound biopsy. And I said, you just mind your own business. I said, I'll call you, don't call me. Listen, prostate cancer in 80-year-olds is like gray hair. Most men will have it, but they won't die from it if you don't punch holes in it. All right? We have killed more men doing that and more ladies punching holes in breast lumps than any thing in the world to make a diagnosis so we get paid for everything downstream. Get out of here. Leave my patients alone, leave me alone. Now, here's what progesterone does. And I give progesterone to a lot of people. If I get a lady who's blonde-haired and having trouble with heavy periods, I'll give her progesterone at mid-cycle, days 10 through 20 of her cycle. Cut the top of that estrogen curve, and she's a happy camper. First girl I had come to me 27 years ago when I first started using bioidentical hormones, a little 12-year-old girl. She said, if you don't do something for me, I'm going to kill somebody 1 week out of every month. She said, I know I'm not fit to live with. Everybody else knows I'm not fit to live with. If you don't do something for me, they're going to have to lock me in a closet. I gave her progesterone cream, 100 milligrams per ml, and I told her to take 1 ml of that per day, days 10 through 20 of her cycle. I didn't see her for 2 years. She came back in. She said, now don't you ever forget where you found progesterone. She said, if you weren't married and so old, I'd kiss you. She said, I use this 2 days a month, the day I ovulate and the day after, and all my problems are gone. She said, I tell my girlfriends what I'm doing. They go to their doctor, and their doctor said, that'll never work. She said, they're on birth control pills, they're on antidepressants, they're on tranquilizers, and they're still airheads. I look in the mirror and I say, do no harm. You can't hurt anybody with progesterone. You couldn't give a lady as much progesterone as she has on board when she's carrying a baby. Postpartum depression is a lady going from 200 milligrams of progesterone per cc of blood to 3 milligrams per cc of blood, and then we wonder why she's got depression. Good night, I tell her to take a bath in progesterone after she has a baby. Of course, keeps her from putting on weight, lets her feed her baby. Come on. Now, here's what it does. It stops water retention and edema. This is progesterone. It stops PMS symptoms. It shortens menstrual periods. It often stops migraine headaches and headaches. It settles nerves and stops emotional ups and downs. It improves memory. It helps with sleep. It can help with thyroid function. You'll never get a lady's thyroid working unless you get her hormones balanced. They're connected. Don't ask me how, but they are. And you got to get her hormones balanced. Yes, sir.
So you give this in a bioidentical form, so you give it for males and females?
What was that?
You give it to males and
You
females?
give it to men and women?
Yes. Yes. Progesterone is a perfect birth control for men. If you read Dr. John Lee's book, there's one page in there on the use of progesterone in college-age men. Knocks their sperm count down so it's not viable. They go off on it, within 2 weeks it's right back up where it once was. Anything you give to a lady for birth control is going to mess her up. I don't care what you use. It's going to make a mess out of her. And if you give a lady birth control pills, I'll guarantee you half of them will never ovulate again, and they'll never have babies. Okay? I'm not going to do that to a girl.
So you combine that also with testosterone cream, bioidentical?
Yep. We'll come to that. If you got a guy losing his memory, I'll give him testosterone. You bet. I'll take everything I can get my hands on to for testosterone. I'll talk about this in a minute, but my brother's doing something I let him do on me, and I won't do it again. Got my testosterone level, so it's out of sight. It's way, way high.